The research nobody is talking about for ulcerative colitis and GLP-1 medications. Could this be the new frontier of autoimmune research? I think so. I'm Jessica Brown. I'm a clinical nutritionist. I'm author of Beyond the Shot, and I love translating all of this new data for you so that it might help your life in some way. But remember, this is not medical advice. It's just educational. So between 2024 and 2025, there have been at least 6 major studies that have been published on GLP-1 medications and ulcerative colitis in leading academic journals like Oxford Academic, Frontiers, National Institutes of Health, Medical News Today, and PubMed. And some of these studies looked at thousands of patients. One of them was a 16,000 person meta-analysis. So we know that the science shows GLP-1s are best known for weight loss, but what we're seeing in the research is that it's pointing to reduced gut inflammation and helping to repair the gut lining in the UC models. The research is saying that this can lower the risk of hospitalizations and steroid use in IBD patients. It could even decrease the need for surgery in severe colitis cases. This is pretty big. Recent systemic reviews and animal studies consistently showed a reduction in those pro-inflammatory signals, which is what drives the disease. It showed a reduction of the pro-inflammatory signals and an improved gut barrier function. These are the things that make people's lives better. These aren't one-off findings. It is clear it's a research trend when we look at all of those 6 studies together. And plus, there are new clinical trials that are recruiting people right now for GLP-1s in the IBD world, not just for metabolic health. So the biggest takeaway here is that GLP-1 medication research for IBD is growing, and it's growing fast, with more studies, bigger patient groups in the last 2 years than the previous decade combined. Could GLP-1 soon become a key part of managing ulcerative colitis? Well, research is going to tell us. It's not just for people with metabolic disease, but perhaps as a direct gut immune therapy. So, what's your experience been? How are the conversations with your doctor? If you're on a GLP-1 medication and you have ulcerative colitis, what's your experience been? I'd love to hear in the comments.